providing resources and comfort to caregivers. This is Caregiver Crossing.
Hello, everyone. Good morning, good afternoon, good evening, whatever time it is, wherever you're listening. Welcome to Caregiver Crossing. Thank you so much for being here. If this is your first time joining us, Caregiver Crossing is a show that is brought to you by our friends at Joy's House, presented in partnership with Cardon and Associates. We're here every week to talk about all things caregiving and more. We like to call it caregiving and more. I'm Terry Stacy, along with
I'm Tina McIntosh.
Tina Bina McIntosh,
I'm just
everybody.
Laughing at you. Caregiving and more.
And more.
And then we also have our producer, Noah Taylor.
Hello.
Hi, Noah.
Hey, you guys, I know you think that because it's almost September that the heat is over. And
Oh, no.
It's not. And so I wanted,
Especially if you got the menopause.
well, that is a different therapy session, my friend.
That
and
heat is never gone.
I will meet you there with our fans and our ice packs. I do want to talk about, though, how to stay a little bit cooler. One, for you as the listener, and two, for the person that you're carrying alongside, because it's really easy for us as we get a little bit older to get dehydrated. Not knocking you out of this conversation, Noah. I know you're in your 20s. You can get dehydrated.
I'm thirsty.
But let's be honest. Terry and I are probably going to dehydrate first, right? So I'm going to give you a little quiz. Ready?
I'm ready.
All right. Energy drinks and caffeine, do they cause hydration?
Do energy drinks and caffeine, do they cause hydration? No.
I don't think they hydrate you.
No, they're caffeine.
Yeah, they can dehydrate you.
Yeah,
Bad.
in a minute.
Bad. But, we all get up and have our tea or our coffee or grab a soda or whatever you grab, and then a little scary.
You should drink 2 cups of water before you do anything in the morning.
Can you chug it or do you have to sip it?
Well, we try to get it down quick because your body has had a bit of a dehydration time. You've not had any drink since you went to bed or even before. And so when you get up, 2 cups of water.
It's like a jump start.
Yeah.
Right?
It's like a jump start. Your body's like, thank you.
And I've heard to do room temperature in the morning. Just kind of let it sit out and go.
I didn't know about that. That's good to know.
I don't know. It might be true. How about a good night's sleep? Will good night's sleep help you with your hydration?
I actually don't know that one.
I don't think so.
I'm gonna guess yes, because I feel like good sleep is helpful for most things.
Okay.
The answer is yes, Noah.
Woo!
Good job. Ding, ding for Noah. All right. And then let me give you another one. How about wearing the weather appropriate protective garments, whether it's a big hat or a shirt? Does that actually help protect you when it comes to hydration?
A hat I would think would maybe help you. Noah, what do you think?
I don't know. That's interesting because, while I know it does protect you from the sun, I know you must sweat a lot.
Oh, yeah. So you're losing the hydration.
You must sweat a lot more,
water.
but
Yeah.
Yeah, it's good for you. It is good, and it does help protect you from the sun's rays too. So all of that, and just want you to know that if you start seeing any kind of symptoms of heat stress, it doesn't have to be 95 and sunny out. This can happen anytime for anybody. And so if there's excessive sweating, to your point of sweating, if there's excessive sweating, if you're getting red or flushed skin, fatigue, dizziness, or nausea seems to be a big one there. Take a break. Let somebody know. Take a break and hydrate.
And here's the thing. Okay, your urine should be almost clear, right?
Well, that's what they say, but I take a Super B, and sorry, it might be too early for everybody on this, but it turns your urine.
B?
Yeah, and it turns your urine yellow.
Not a Super
some
B.
medications.
You're having a Super B.
B, as
like
in
the B vitamins.
As in B.
And so does it turn it a little yellow?
Yeah, really yellow.
Really yellow.
Does
Okay, so
everybody wanna know
vitamin might
this?
change. No, I mean, it's important because they
It
always
is.
say if you're hydrated, your urine should be clear. I know this, like when you go to a sporting event, you're sitting out in the sun, they say, make sure you keep your urine clear. So you're staying hydrated.
Drinking a lot of caffeine or drinking a lot of beer at an event, that is not hydration.
No.
Right?
It is not.
I think back in my younger days, I thought that was hydrating.
Hey, did you know in our lifetime that the amount of saliva and spit that you produce could fill 2 swimming pools?
I would like to vomit right now. Do you know that spit and I do not go well together? Like,
is that right? Do you have a spit?
I don't like. I heard you talk about something else.
I've known you for so many years.
I do not like. I don't like it.
But can you imagine 2 swimming pools filled?
I am going to leave the studio.
to walk out the door.
Oh, it grosses me out.
Okay, let's talk about kids and caregiving. Because do we have time? Now that we talked about, we're not even really going to transition well with this.
No, please
We're
talk
just
about anything other than swimming pools filled with spit.
Picture this. Thank you for this. Noah brought this to our attention. And this is really, we've talked about this for a few years now, about the age of caregivers, right? And Noah, you found something with the American Association of Caregiving Youth. It is the only organization in the country dedicated solely to talking about and addressing caregiving youth issues. And this is pretty amazing that there are over 5.4 million caregiving youth in the United States.
Think about that. Hold on.
5.4
million caregiving youth in the United States. These are people under the age of 18 who provide some kind of, significant assistance or care for a family member with a chronic illness, a disability, or a mental health condition. 5.4.
And think about how hard that must be. You're under 18, you're living life, you're in school, there's activities, there's social events, it's the time of dating and obviously then studying and making good grades. And then on top of it, now you're somewhat caregiving, if not the whole caregiver,
yeah.
all the time caregiver.
Noah has a thought bubble.
Well, I was just kind of thinking, like, this is a whole, like, these people they're not even sure of who they are themselves yet. And they already have this whole other job that they have to take care of. And they get behind on school, they get behind in other areas of life. And that, I think it just can take on a whole lot.
So this group is actually was founded and is run by Dr. Connie Siskowski, and she and I talked years ago about bringing this organization to Indiana, and then I think COVID hit, and we all lost our minds, and I forgot about this important work until Noah brought it to us, and so. Can we get her on the show?
I would love to have her on. We're going to reach out. We're going to reach out and get Connie on here, Dr.
Connie.
And just see the latest, because we've talked about it for a long time. Well, the last few years, about the age of caregivers getting younger and younger, and to see this number of 5.4 million, that's bigger than I ever thought, for sure.
Well, it's a lot. Okay, I know we have to take a break. I want to say this very quickly. Last week, we talked about ideas for aging for the state of Indiana. I'd like to hear you email me, please, and tell me what you think would make it more fun, more purposeful, all the great things to age. What makes it easier for you as you're aging? And so no idea is too small or too big. You can email me at tina@joyshouse.org and also provide feedback for the show. And so we will be back in just a moment.
You are listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you by Joyce House in partnership with Cardone & Associates. With 20 communities owned, operated, or managed in the Midwest and more than 40 years of senior living experience, Cardone & Associates provides residents with the best senior living options and personalized service. Visit cardone.us for more information and to find a community near you. Stay put, everybody. We'll be right back with more Caregiver Crossing after the break.
We're back on Caregiver Crossing. I am Tina McIntosh, and I am joined in studio by my beautiful co-host, whose name is
Terry Stacy.
Good to have you here.
Thank you.
Our producer,
Noah Taylor.
We've added one.
There's a new person in the building.
We've added some handsome gentlemen to the room.
Yes.
His name is Bruce Muller, and we're going to learn so much. And Bruce, I'm going to tell you up front. Well, first of all, it's nice to have you here.
Good to be here.
These topics make me want to poke my eyes out.
No matter how many years Tina and I have been talking about.
No, it's a true story.
Medicare or Medicaid, we get our head spins around.
Yeah. So Bruce, it's nice having you, and you get to lead your own interview for the next 2 segments.
That's right.
Okay.
So Bruce is he's one of the dedicated regional volunteer supervisors with the State Health Insurance Assistance Program, otherwise known as SHIP, which is much easier to say. And so he has a lot of years of experience in this and other areas, but he has been a really invaluable resource for, I don't even know how many seniors who are navigating the complexities of Medicare. And we say the complexities of Medicare, and we mean it. So thanks for being here. Would love to know, for those who might be hearing about SHIP for the first time, what is it?
Well, SHIP is, as you mentioned, the State Health Insurance Assistance Program. We are federally funded, and in the state of Indiana, we are sponsored by the Indiana Department of Insurance. It is in all 50 states. They all run their own program. We have become McDonaldized in that our logos and
McDonaldized.
our program, we all use the same.
I like that.
We all use the same
Right.
logos and information and everything, so that if you go to Missouri, you will spot us maybe at a health fair because it's our orange tablecloth with our insignia and everything.
Well, I think that is important. So if we've got somebody who's listening in another state, because we're based in Indiana, but it doesn't matter. You can be in Illinois, you can be in Michigan, you can be in Maine.
Right. You can be anywhere, and there is a SHIP program.
Fantastic.
So again, we're offering local help for Medicare, and we are not affiliated with any insurance companies. We are not commissioned or anything like that. We're pure help. You sign up for Medicare through Social Security. And if you have questions and how do I do it, I'm so confused, they'll tell you to call SHIP.
So anybody can call.
Yep, anybody can call.
For free.
For free. Yep.
And Medicare is for whom?
Medicare is for people who are 65 and older, unless they are disabled, obviously being being disabled under 65 on the 25th month of their disability, they would qualify.
I don't know what you just said. See, this is where I get really confused.
Yeah. So if you're under
So I'm closer. So to that 65.
So if you're under 65 and disabled, you are able to get Medicare at a certain point in time.
Got it. But if you're over 65, you definitely can get Medicare.
You'd have to get Medicare.
Got it.
You have to get Medicare. And this is where we get confused because it feels like there's so many different programs. And that's why you're so instrumental. Kind of give an example of how, if I come to you, I just turned 65, tell me how will you handle me?
Well, if you're just turning 65.
Gently.
Yeah.
And please, if we could talk to me like I'm a first grader, that'd be great.
I always say, actually, I'm in the healthcare business because I'm trying to keep your head from exploding.
Yes.
Thank you.
So if you're coming to us and you're just turning 65, what do I do? How do I take, my Medicare? Well, first of all, like I mentioned, you sign up for it through Social Security, and now you've come to us because you don't know what to do.
They don't know what to pick, right? Because you've got all these
right.
different options.
You have the option of what we call original Medicare, and that's what we call alphabet soup, because there's Part A, B, D, C. So Part A is for basically your hospital. Part B is basically your physician and other services. Part D, as in dog, is the prescription drug program, and Part C are the managed care programs, otherwise known as the Advantage plans.
Hold on, and then can I have all four?
No. So here's where the problem.
You're gonna have to give up C.
That's right. Here's where the problem comes in, or the main explanation comes in. Original Medicare, A, B, D. And also a supplement for your Part B. A is free. B is we're going to charge you a premium. Everybody gets that premium, whether you're with Original Medicare or on an Advantage plan. Right now, that premium is $174.50, and you have to pay that
a month.
Most of the time, that's all paid from your Social Security check.
Okay.
Oh, wait a minute. Is that coming out of my Social Security check, you mean?
Mm-hmm. You could pay it yourself, but
I don't know why, but I was thinking, okay, I do need to pay attention because I was thinking this was all free.
No,
I turned into a senior.
Terry.
I went on Medicare, and it was like I was going to pay maybe a couple bucks a month.
No, you can call Bruce for free, but the insurance coverage is going to cost $174.50
I didn't know
a
it was
month.
coming out of my. I guess it would come out of my Social Security.
Yeah. Or if you're not,
I'm not getting anything, am I?
Yeah.
I'm going to be old before I can really retire.
Yeah. And so, if you're not taking your Social Security, then you do have to, pay for it.
I have to
in another way. So that Part B, then that premium, and we're going to pay 80%, and then you have to pay the other 20% of the cost.
Okay.
Okay? And that's where you get a Medigap or supplement plan. And that covers those extra costs, okay? Any co-pays or, other expenditures. So actually, when you do this way and you've paid that supplement, you really end up with no Medicare bills except for your prescription drug plan.
Okay.
Which we know can get expensive.
Well,
yeah.
I mean,
excuse me. Here's the good news. Your Medicare drug plan next year is going to have a maximum out-of-pocket of $2,000.
What?
Now, that's still a lot of money.
No, but that's wonderful. I mean, listen, we
That's
hear
the
people
maximum.
all the time talk about they go broke and can't afford, nutrition because they're paying so much for prescriptions every month. You're saying $2,000
Out-of-pocket.
a year?
Yeah, that will be the maximum.
And that begins next year.
Next year.
How did that happen?
Must have been a mistake.
Yeah, sounds right. Don't tell anybody. Nobody speak of this.
Oh, no.
Oh, that is.
Yeah, I'm sorry we're on a radio program because now the legislators are going to know that we're,
Right, that they made a mistake.
I mean, I don't want to shout anything here, so I'll definitely not tell you you're listening to the voice of Bruce Mueller, who is the regional volunteer supervisor with SHIP, which is the State Health Insurance Assistance Program. And so go ahead.
So the good news too to that is that they will be able to set that up on a equalized payment program. Now that's still just how that's all going to work is a little bit out. But
so that'd be like we could do like $100 a month.
Or
whatever. You can figure out how to do it. It's not all one lump sum of a couple thousand.
So they won't have to worry about having a deductible and everything in the beginning.
Interesting.
So
that's life changing for a lot of people.
That's basically doing away with the donut hole.
Yeah.
Which is in fact, I had a taste of my own medicine when my wife came home the other day with a high bill because she fell in the donut hole.
She fell in the donut hole.
So she was like, "Oh God, now I got to explain this all to my own family."
Yeah, it's that's pretty incredible. We're going to have to take a break here in just a moment. Tell me very quickly, is this all of Indiana? I mean, like any state you're in, it can be rural or urban.
Yep.
It doesn't matter where you live.
That's federal. Yeah,
it's federal, all over the country.
Yeah, don't forget that Medicare is federal, Medicaid is by state.
I'm asleep again.
Yep.
Here's where we get the confusion. Here she goes. We're losing her.
No, it's really. Listen,
I agree.
I'm a very smart person, and this is my area of expertise is in aging issues. Medicare and Medicaid, I'm not sure I'm ever going to fully understand, nor do I need to, because there are people like you, Bruce, who are going to help me when I get to that point where I need the assistance. And so I'm okay with not fully understanding it. Now, we need to take a break. We will be back in just a moment. Bruce, you're going to stick around for the next segment, right?
Yeah, indeed.
Okay, that's a deal.
Don't go anywhere.
Looking forward to it. Until then, this is what we're doing. We're called Caregiver Crossing, and this is a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you as a service of Joyce House in partnership with Cardon and Associates, with locations in Broad Ripple and also near the University of Indianapolis campus. Joyce House provides exceptional day services for individuals living with a life-altering diagnosis and compassionate support for family caregivers throughout our community. At Joyce House, we believe that everyone deserves to live their best life, regardless of their abilities. Learn more about our adult day and also our caregiver support services by calling us at 317-254-0828 or by visiting joycehouse.org today. That web address again is joycehouse.org. All right, we're glad you're here. Hope you can stick around because we'll be right back with more Caregiver Crossing right after this. Welcome back to Caregiver Crossing, and I'm Terry Stacy along with Tina McIntosh. Producer Noah is here, and we've been talking to Regional Volunteer Supervisor with the State Health Insurance Assistance Program, also known as SHIP. That's SHIP with a P. And with us is that guy. Yeah. Bruce Mueller is here. We've been talking to Bruce. Bruce just told me he's getting ready. You're getting ready for a trip.
Yeah,
we're west, and you're going to see your brand new grandbaby Cooper in Missoula, Montana. I love the name Cooper. I love the name. Thanks for sticking around with us for a few more minutes. I'm glad you're here. Most frequent concerns or questions that you hear from seniors when they're considering their Medicare options for the coming year. What are the big concerns?
Well, their concerns, if they're already in Medicare at this point, they may want to look at changing plans.
We hear that on a TV commercial that runs nonstop.
Yes.
And so the problem with changing your plans is if you're already on an Advantage plan and you've been on Medicare for a period of time, people say, oh, I want to go back to original Medicare. Well, in theory, you can, but in practicality, now at this point in time, the company that provides that supplement or Medigap policy can now underwrite you, meaning they can look at your health issues and see if they want to take you.
Oh, yeah, we don't want that to happen.
Cost.
No.
So that's why it's kind of important to choose what you want to do at the proper time. Well, you can always go to an Advantage plan, but it's a little bit more difficult to go back to original Medicare. But when you do take an Advantage plan for the first year, you have a trial right. So you can go back to original Medicare if that's what you want to do.
The first year.
Mm-hmm.
Now, hold up, because there's an open enrollment part, right? And that's a critical part of this timeline?
Yeah, well, the open enrollment is mainly, it's kind of a little bit of a misnomer. That's if you want to, basically if you want to change your plans and things, but it is also a period of time when people under certain conditions, want to do enrollment. For instance, the main thing to do during open enrollment is to review your Part D, as in your drug plan.
Why is that so important?
Because maybe during the year you've got a more expensive drug that your company either is expensive or it doesn't cover. So now's the time you shop to make sure you're getting the best pricing on your drug plans, just to make sure that you're not paying more than you need to. At our site in Bloomington a couple of years ago, a doctor told a lady, you need to go see someone at this organization because that's not right that you're paying a little over $30,000 out of pocket.
Oh, my golly.
So she did come to us, and it was this time of year, and we reviewed her plan, and we have something called the Plan Finder. We can look at all the plans available to you in the state of Indiana. So when you do that, then you can pick out a plan. This lady picked out a plan. The drug was basically covered pretty well, and it saved her $30,000 a year.
Can people just call you at SHIP? I mean, not you necessarily, but someone at SHIP to get more information? How do they do that? Do they just call? Do they show up?
No, they just call. But they can call and, okay, well, I need some help. Maybe it could be done over the phone, or I live in Fort Wayne. I want to see somebody in person. So then we can refer that call to the SHIP site in Fort Wayne.
I just have one quick question.
I have a question too.
Do you?
You
go first. Okay, I'll go quickly. Before you turn 65, it's your birthday year. You're about to turn 65 somewhere in this year. When do you start thinking about
Are you asking
Medicare?
for a friend?
Probably.
I'm asking for a friend.
Yeah, oh yeah, we've heard that before. So you really about 6 months before you want to start exploring everything.
Okay.
But for sign-up purposes, you have 3 months before your birthday, the month of, and 3 months after.
Oh.
But what we tell people is, be careful. Don't procrastinate.
Yeah.
Because before you know it, that clock is ticking, and then you have to make that decision of, do I want original Medicare or do I want an Advantage plan? And you don't want to do that under pressure.
I also want people to be very careful because there are so many scams out there, right?
Well,
and all this misleading information.
Well, and the one thing is that people go online and then they start looking at all these different companies and plans and everything. And sometimes they give them too much information, which they want your information so that they can capture you and hopefully become a client. Using an insurance agent, we always recommend you use somebody local. Don't use the 800 numbers or things like that, where they're telling you if you sign up with us, you get a new car and, all these things. But
yeah, I don't think that happens. People don't sign up for a new car or a trip
But seriously, you really want to deal with somebody local that's going to take care of you.
Yes.
And, I have a relationship with a lot of insurance agents because there are questions that they get jammed up on and they call us for help.
Now, there is an 800 number that you can call, right?
Yeah,
and that is the one for SHIP. And what is that number?
800-452-9800.
I believe it's 4,800.
4,800, excuse me.
I only know that because Bruce brought us these great little sewing kits, and it's right there.
I'm a little nervous. I'm looking at my notes. 4,800.
1-800-452-4800. And we will put that on our Facebook as well. And Bruce, I can't thank you enough for the work that you do because it is really complicated. And so thank you for the work you do. Thank you for being here with us on Caregiver Crossing.
Appreciate it. That time went too doggone fast.
I know
it's
You'll
way
be back
too
again.
fast.
We'll have you back.
So here's what I do want to point out, that Medicare open enrollment for 2025 You got to be thinking about this now. Open enrollment takes place from October 15th till December 7th of 2024. And then those changes will happen on January 1st. And so make that phone call. Again, the number will be on our Facebook, but 1-800-452-4800 and get yourself in line. And speaking of open enrollment, Joy's House is also accepting new families right now. If you're a caregiver, of course, you can email me, tina@joyshouse.org anytime, and we'll see what we can do to help you out with our programs that we probably haven't talked about enough recently, but we will. The other part of things is that our adult days. We have had some losses recently, which is unfortunately part of the work that we do. And we're missing those folks. And we have some space where we are ready to love on more people. And so if you've got somebody in your life who is living with some kind of a life-altering diagnosis and could use some adult day service, Monday through Friday, 8 to 5 p.m., or somewhere in between those times and days, reach out to us at joyshouse.org. And we would love to see if we are the right fit to help take care of your loved one. But it's just important for us to get that out there, Noah. Anything I'm missing on that?
No, I think that's really wonderful. I think it's important to emphasize that we really love our guests so much, and we do anything and absolutely everything to make sure that they have purpose and that our guests feel comfortable and that, please come check us out.
I did a speaking engagement not too long ago, and after I got done, I had probably 3 people stand up and give testimonials about people they've loved who've come to Joy's House and say, like, you're not talking enough about how you see everybody as an individual, or you're not talking enough about the activities that you do, or the food, the good food you have, or the community you have there at Joy's House. And I think sometimes, for me, Noah, after doing this 25 years, sometimes I forget, the way we do things here at Joy's House is really special.
It really is. It's
we
unique
really care
and different for sure.
So, if you have anybody that you think could stand to utilize our services, rather for themselves or their caregivers, to give them some respite, get in touch with us. joyshouse.org, 317-254-0828. Now, we're going to have to take a break. So in the meantime, know that you are listening to Caregiver Crossing. We are a show designed for family caregivers and the people who love them. And we're brought to you by Joy's House, which is where we are taking our referrals and want to help, in partnership with our friends at Cardon and Associates. And with 20 communities owned, operated, or managed in the Midwest, more than 40 years of senior living experience, our friends at Cardon and Associates provide residents with the best senior living options and personalized care. And so you can visit them at cardon.us for more information or to find a community near you. And we want you to stay put. We're going to take a break, but we will be right back with more Caregiver Crossing right after the break.
Welcome back to Caregiver Crossing. Thank you so much, Bruce. What a great guest. And I'm Terry Stacy along with Tina McIntosh. Hi.
Don't jump into this. Right before we came back on air, Terry looked at me and said, spit. Because if you were with us at the top of the hour, she was talking about how over the span of our lifetime, our saliva is enough to fill 2 swimming pools, and it makes me sick. So if I have a tone in my voice, it's because Terry looked at me right before Noah said live and said spit.
I turned 10 years old, and I couldn't. Now I've been told
so gross.
Now that I know something. It's her one weakness. She didn't want to talk about spit. Anyway, thank you all for joining us. We'll be here for a few more minutes anyway. Let's talk about something that I've been reading a lot about on some of these in social media this week with some of the family caregiver Facebook groups. The topic of loneliness. We've been talking about loneliness among caregivers for a lot of years, and we always think, well, there's so many resources, and we keep talking about it. Perhaps that this is not a commonality anymore, that loneliness. Maybe that's starting to get better since caregiver is a part of our conversations these days, whereas opposed to years ago, it really wasn't. But since we've talked about it more, I thought perhaps that this is, and there's more resources out there, right? But it is still a conversation.
Yeah. And Noah brought this to our attention. Noah, I know you've got some tips too, so I want to make sure you've got your voice in this. But there was a report that Noah shared with us from the National Academics of Sciences, Engineering, and Medicine. I'm sure you all read it on a regular basis. And it points out that more than 1/3 of adults over the age of 45 and older, so older than 45, feel lonely. And nearly 1/4 of adults over the age of 65 are considered to be socially isolated. I want you to think about that. 1/3 of us over the age of 45 feel lonely. And over the age of 65, 1/4 of us are considered to be socially isolated, not just at risk for, socially isolated.
Completely.
Right?
Yeah.
And what that does to our mental health and what that does to our physical health, all of the things. And so, we're hearing more and more about depression, anxiety, suicidal ideation, suicide attempts, suicides with people who are in the second half of life. And we've got to do better for each other.
I agree. I think in this day of age of social media that you feel like everybody is connected, but the more connected we are on social media, the more isolated, and it's what I'm hearing, the more isolated, the more lonely we are, because there's, and I guess I can't understand what's happening or how this has happened. Well, I know as you get older, like for me, I've lost a good amount of my friends are gone.
Right.
And so at times I do feel lonely. I miss that closeness that I had with people, even though
you're Terry Stacy. Think about it. You are beloved. Like anybody who knows you has wonderful things to say about you. But I hear people say, I feel loneliest in a crowded room, and that breaks my heart.
Yeah.
But I even, and I've got really incredible friends, but there are times that I'm like, who do I want to call and tell about this thing, good or bad?
Yeah.
And I run through a list of a handful of people, and then I stop, and then I don't call anybody, and then I don't share the thing. And that is just kind of a filter into a loneliness, I think. So
I see what you're saying.
I think it's very real. I don't know, Noah, you had done some homework on this, like tips for overcoming this?
I did find some tips. So, obviously this is a very hard subject, and maybe not one of these tips will work for everybody, but hopefully they can be a little bit of a guideline about how to help some of your loved ones. So number one, we have to encourage regular social interaction. Suggest that your loved ones engage in activities that foster social connections, maybe like joining like a book club, attending community events, or even like participating in a group exercise class at a gym. I think that can make even all the difference, having that community.
It's some kind of interaction with people, right?
Yeah.
Like even if it's a FaceTime call, or like my mom doesn't have FaceTime, but we'll snap video each other on occasion. There's something about seeing other people in real life or in technology.
That is true.
Yeah.
I'm wondering, because you've been talking about, how this on aging, how to make it more fun, how to help aging be better for people. And I'm wondering, how engaged are seniors on social media? You run adult day service. Is social media a part of their lives? Is it?
Yes. Now, on the adult day side of things, let's be honest, people are coming here because they have a life-changing, life-altering diagnosis. So maybe not the guests who come to our Joy's House adult day services as much, but the caregivers for sure. And, I can tell you this, some of these even anonymous groups bring a community, and I know you've got more tips, but this is good. I had a tubal pregnancy, an ectopic pregnancy a long time ago. And at that time it was like dial up, like, getting into it. But in the middle of the night, when I would be sad and angry and confused and lonely and scared, I would log onto my dial-up computer in the other room. I would get on, and there was a group out of the UK who was all about tubal pregnancies, because it's a different kind of a loss. And those women who I communicated with at 3 a.m, who I don't remember even their handles, but I definitely don't know their names, changed my life, saved my life at a time when I was really, really sad.
Wow.
So if we don't know technology, we need to teach it to people and how to use it to their benefit, right?
Right.
And not get sucked into the social standards and all the BS that is not real.
Exactly.
Right.
Because you can just use FaceTime, video calls. Skype, those are all really perfect ways for your loved ones to see you and spend some time with them. So another tip we have is to promote volunteering.
Love that one.
Yeah, encourage senior adults to volunteer in their community. This not only provides a sense of purpose for them, but it also gives that community aspect again.
Oh my gosh. And if that's, working at a food pantry or whatever it may be, it's magnificent. And I'm starting to see more older people volunteering their time and getting involved. And there's a million things you can volunteer for. Whatever you love, just check that out.
All right. Do you have one more? Because we got to go.
One more tip for everybody. And this is my favorite. I actually talked a little bit about it on here last week. facilitate relationships that are intergenerational, opportunities for seniors to interact with younger generations. I think this could involve mentoring programs or family gatherings.
Good for everybody.
Yeah.
You know what we need to come up with, and we've got to wrap up here. We need to come up with some tips for how to do that. How to do these things. So we'll work on that. All right. We're going to have to close the show. You can always email me at tina@joyshouse.org, and we can help you with your caregiving journey, or give us feedback on the show, how to age well, all the good things. And we also want to say thank you to Cardon and Associates. They are our wonderful friends, providing residents with the best senior living options and personalized care. And we are so grateful for them and everything they do in the Midwest. And so until next week, take good care of each other.